The following video is researched and evaluated model in the treatment of violence, mental health, suicide and homicide prevention. United Nations and World Health Organization guidance is the monitoring of services needs to include the viewpoint of service users. In one country, gang violence, corruption has escalated to the depravity of a woman murdered every 36 hours and girls as young as 11 thrown to be used. We are leading in naturopathy expertise in respect of treatment of violence, tragedy and trauma. There has been rapid growth in demand for naturopathy education, training, skills in medical schools. We have been working to develop integrated medical research submissions with Medical University in Italy. We showed the following video to the EU Mental Health Commissioner who wanted to know how we achieved these results. Marian Mulligan, CEO, Sphenoid Ireland. This is mental health by natural means. The treatment group here today showed significant improvement and sustainability.
I'm Anne-Marie, student at the Irish Institute of Naturopathic Medicine. We have interrupted suicide and homicide in Ireland. We have been working with addiction, violence and domestic violence in the communities around Ireland. I have seen the results. This does work. We need to make this training and treatment programme available across Europe. This will change the way we look at our health into the future. Mental health by natural means is the way forward.
I'm Hilary. I'm a mother of 4 children. I got seriously ill from a build-up of shock and trauma and postnatal. I gave up on living. I didn't talk, I didn't eat, I didn't sleep and I didn't care. After my 3rd child, I was diagnosed with psychosis and on medication but wasn't working. So I was referred to this clinic for treatment. When I was pregnant with my 4th child, I was taken off all medication and I continued my treatment. I was in a very dark, negative space and at risk, me and my baby. And the treatment saved mine and my baby's life. Now I am well enough to look after myself and my children, and that's all I need or want. So it's vital to me and my children that I continue this programme. It's our survival. I no longer have psychosis and I'm off all medication and looking after my own children myself.
Hello, I'm Tess. I wanted to walk into the sea. I was hospitalised, I was on medication and nothing worked for me. No medication reached my pain. I was attacked in childhood. I suffered with panic attacks. I was paranoid. I thought everybody was talking about me. I didn't want to go into crowds. I hated going to school. The panic attacks were very bad and there was problems at home. Mum was an alcoholic and at one stage in my life during my teens I was turning into an alcoholic. I just turned to the bottle because I thought it would deal with the pain. I got a referral from the doctor to come up to the INM and I came in and the panic attacks, everything was there when I came, but from the treatment programme now I have my life back. I don't suffer with panic attacks. Now I have not been back to hospital. I'm on no medication. I do hill walking and I have my life back. This treatment programme should be available for everybody throughout Europe. It's so important. It's a new programme and it really reaches the pain for people.
Hello, my name is Leonard. I'm attending the Institute at the moment, but prior to that I had suicidal tendencies, a mental breakdown, left with schizophrenia, paranoid schizophrenia. While I was hospitalised in the first unit, I had to be bodyguarded by 2 nurses, and when I went to bed I had to have one stay in the room with me to try and keep control. I was talking to one of the senior nurses at a later stage, and I asked him how bad was I really, and in his 40 years he said I was in the top 3 of worst patients he'd ever dealt with. At one stage, when I was so bad with the suicidal and homicidal tendencies, I was on Brighton Pier, and I was going home to actually get me 2 young children that I wanted to walk back down and actually jump into the sea with them. I haven't been back to hospital. I haven't been to prison. I haven't fell since my treatment. It was beneficial for me, the treatment, and that's where the start of my recovery came from my first treatment in the Collegiate House with Marian Mulligan. I would have had umpteen staff members in the hospital securing me, and now my file, my psychiatric and doctor file would be the size of an encyclopedia, and the money that would cost to keep me in hospital and treat me would have been immense if I had been in and out of hospital up to this stage.
His father was shot dead when he was very young, 12, 13 the month after. He's very angry to the fact that there was no one ever done or justified for the death of his father. He can't understand it, so he turned violent himself, first in robbing cars and endangering people's lives. He got time for that, and then he did go on the straight and narrow for a few years. That's when I got involved with yourself, Marian, and you helped and supported him, and he did go straight and narrow. Danny then returned to violence. He was stabbed 17 times, and 3 times previous to that. So 21 times in all, Danny was stabbed. My son needs the support of her and other young people in the community towards violence. He's getting on very well since I got back in touch with him, Marian. He's been doing anger management, he's been doing alcoholic talks. He's settled down a lot in himself. He still has angry and vicious moments, but I know with yourself, they will go. The community needs the support and help that you are given. Danny has changed his life around, and he wants to change his life around. Danny wants to be a father. He wants to be accepted in society. He wants to be loved. He wants to be a part of this world, and which he hasn't. He feels he's been pushed aside.
He feels he's been excluded?
Yes.
Thank you, Maggie. We wish to introduce some of these treatments and ask for your support in their implementation at European level.